Okay. Welcome, everyone, to this session on unlocking the EU's potential for investing in health. Welcome, again. Welcome to our online participants, probably for the first time. This is one of the first sessions at this year's Gastein conference, and we're really happy to see you here, so many of you in the room and so many of you online. For those of you who've been here before, you know we've been talking about investing in health a lot over the years, both in terms of how we make the case for it, but also in terms of how we make the best use of the instruments and the options that we have. Today, we focus a little bit more on this second part, and especially on how the EU can help with investing in health. And this whole journey, or part of the journey, started with the Slovenian presidency of the Council of the EU back in 2021. And Slovenia put very clearly on the agenda this need to make it easier for member states to access the support that the EU can afford for them, and called for a one-stop shop solution in the Council conclusions that would make that happen. So with that in mind, Austria, Belgium and Slovenia went to DG Reform and asked for support in figuring out what a one-stop shop like that could look like and what it could do. This has been a project that's been running now for a couple of years, and where we see really interesting results. We're not going to talk about the project results only in this session. We're going to talk about the broader issue, but we will also reflect on what we've learned and how we can take it forward. We have, as I mentioned before, a really full session. We have 90 minutes. We're going to make very good use of them. We're going to have a short keynote in the beginning, followed by a high-level panel, followed by breakout sessions, followed by a second panel. So at the end of all of that, you're going to know everything there is to know about the topic, which is very good for you, but hopefully you will have given us also all of your ideas on how we can take this area even more forward, which is very good for us. So win-win for everybody. A couple of housekeeping rules. The way that we've set it up is that we have interaction possibilities, of course, with all of you in the room, particularly during the breakout sessions, but also using Slido, which you know very well from Gastein before, and which you will see also, hopefully, on your screen in a minute. For those of you who are online, unfortunately, we don't have the option, because the session is really packed, to have you directly interacting with the speakers of the session. But we will have Slido interactions with you, both with a question that we're going to pose in a second, but also with any comments that you like to put on the Slido that will be fed back to us after the session and that we can then take forward. So to bring us all into reflecting about why it is so important to unlock our potential for investing in health, and especially why we need to come together at the EU level, we have a first question that we ask everyone to think about and use Slido to answer. And you see the barcode or the QR code on your screens, which is what are the areas in your health systems where you feel reform is urgently needed. So take a look at the Slido and give us a word or two words that reflect the areas where you think reform is in your systems is most needed. And then we can reflect throughout the 90 minutes about how we can potentially make sure that we support countries in their endeavors to actually address these issues. So I don't know if we have results already on the Slido. I am not on Slido myself at the moment, as you can see. So I don't know if colleagues on the technology controls, yes, I see thumbs up, could project perhaps first results. I think we have 13 participants, so that's a lucky number. Maybe we get a word cloud. Ah, okay. So we see, of course, some very unsurprising results here: health workforce, digital transformation, financing, healthcare workforce governance, digitalization, equal access, mental health, and a lot of clusters that you can see, and a lot of clear consensus, I think, if not perhaps on the first line priorities for each of your countries, but on the overall themes, and that health systems as they evolve, they need to change, they need to adapt, so reform is needed, and the adequate support for that, of course, is crucial. So the next step in our session then is for us to listen to our keynote speaker, Nick Fahy, who will slowly go up to the podium. to give us his reflections on why this topic of investing in health is both so important and so challenging. So Nick, over to you.
Thank you, Dimi, and my thanks to the Organised session for this invitation. Good afternoon, everyone. This is a long-standing challenge, as you've said, and it's my pleasure this afternoon to talk about why it is important to invest in health and what it means for us to be able to do that in practice. So I know it may be obvious to a lot of people in this room, but let me turn first to the importance of investment to the efficiency of our health systems overall. We've just seen from the Slido the emphasis on the importance of our healthcare professionals. But however skilled and motivated our healthcare professionals are, if we do not give them the right tools, the health system as a whole will not work efficiently. The European country that I know best, the United Kingdom, is unfortunately a striking example of that. The NHS has much discussed problems of low productivity and low investment. Analysis by the Institute for Government has identified key bottlenecks around technologies such as diagnosis, where the lack of investment is holding up care, pathways, a lack of managing patient flow effectively, and discharge, in particular, an inability to have enough facilities to discharge patients who need to go into social care. All of them related to a lack of investment. And we see similar changes and similar challenges throughout Europe, albeit to different degrees. We already spend an enormous amount of money on our health systems, colleagues. But if we do not make the investments to maximize the productivity within the health systems, we do not get the full value of the money that we are spending. But even beyond our health systems, the second point I would like to make is that investing in health has multiplier effects that bring benefits across the whole economy. In economic terms, health can be seen as a component of human capital, and investments in that human capital bring wider benefits. Benefits through people being at work who are more present, who are more productive, who generate more value, and, well, bluntly, colleagues, who pay more tax. There are benefits to education from people who don't just learn better, but who have the platform of good health that makes them more inclined to invest in those skills for the future. And there are benefits to families from reducing the loss to the economy of family members who have had to leave or reduce their economic participation because they're caring for family members who are sick. But in policy making, we typically see those benefits being discounted or indeed not recognized at all. But if these economic contributions are not accounted for, then our economies have a permanently inefficient allocation of the funds that we invest. And the result of that is that our European economies are less efficient and less prosperous and less sustainable for the future than they would be if we made the appropriate investments in health. So maximizing efficiency of our health systems and recognizing these wider economic benefits of investment in health, that makes a pretty good case. But that leads to another question, which is why, in 2024, after the worked example of a global pandemic, do we still have to make this case? After all, the World Health Organization Commission on Macroeconomics and Health, chaired by Jeffrey Sachs, set out the economic necessity of investing in health at a global level in 2001. The report of that commission made clear that for developing countries, health isn't a consumption good that you spend your money on after you get economic growth. It's an investment that is key to how you get economic growth. And Mark Surker, Martin McKee and colleagues in their report on the contribution of health to the economy in the European Union in 2005 showed that the same logic applies in the high-income case of the countries of the European Union, even though the investments needed in that different context are also different. And then what investments make sense was addressed by the European Commission's expert panel on effective ways of investing in health, which issued 26 opinions on that between 2012 and 2022. So we've had the case made. We've had both the general argument and the detailed guidance on how to invest in health. And so it's disappointing that the needs for and the benefits from investment in health are largely absent from the vision of the new Commission. Although the mission letter for the Commissioner Designate for Health does mention investment in preventive measures, it describes those as a means of reducing costs within the health system, not as a contribution to economic growth and wider society. It's also the case with the Draghi report on the future of European competitiveness, which recognises the importance of health, but again, as something that competitiveness pays for, rather than as a contributor to European competitiveness. And it is striking that this is exactly the thinking that the Sachs report and the report by McKee and colleagues showed needed to be updated over 20 years ago. And this is particularly strange because our unique contribution to solidarity in health is part of what makes Europe distinctive at the global level. This is a cornerstone of our social model and of our societies, and therefore also of our economies. And I wonder if, in an odd way, part of the issue as to why we have to keep making this case is exactly that we see health as a good in its own right. I imagine that for everyone in this room, the value of health and investing in it is clear. It might even feel as though we're diminishing our recognition of the intrinsic value of health if we try and justify it also in economic terms. But we need look no further than the current policy discourse that I've just described to see that clearly we do still need to make that case to the benefit not just of our health and our health systems, but to the benefit of the economy as a whole. Now, how can we do that? Well, the first requirement is high-level political leadership. And I'm not going to say more about that because there are much more qualified people to talk about that who will be speaking in the panels that come in the rest of this session. But I would, as a researcher, also emphasize the practical matter that it is actually quite difficult to analyze and demonstrate the economic return on investment for specific investments in health in ways that show their value in comparison to potential competing investments in other sectors such as defence or education that finance ministries rightly have to consider. I know how difficult this analysis is because we do this work in my own research group. Demonstrating the full value of investments in health requires analytical frameworks that can capture the different components of that investment, the direct benefits, but also the investment dimension through which investments in health as human capital can deliver long-term economic returns. My colleagues, led by Dr. Marco Hafner, have developed models for whole economic systems which can analyse the interactions between different sectors and actors within an economy and provide robust calculations of the return on investment of new health technologies or other investments. We've also applied those more broadly to other kinds of investments, such as a study we did together with the University of Cambridge on the overall value of learning additional languages, which I'm sure many people in this room would agree is something that the UK would benefit from. But another key requirement is data. One of the things that we have found is that obviously any model that we build is only as good as the data on which we can base them. And our capacity to show the full value of investing in health depends on good data about the difference that such investment is making, both within health and beyond. We're relatively good at collecting data within health. We're collectively much less good at being able to link that to the benefits in the rest of the economy. And that's a key component of being able to make the case for further investment in the future. So, in conclusion, I think it's clear from the arguments that have been made over decades that the case for investing in health is a good case, not only to maximize the value of what we already spend on our health systems, but also as a contribution to overall human capital and economic growth. And we can do the analysis to support that, though it is challenged, and our capacity to do challenging, and it will be strengthened by better data on the investments that we do make. But despite the decades of evidence and that worked example of a global pandemic, our current political discourse shows that we still need to make that case, and that ultimately depends on political leadership and willingness to do so. But by better demonstrating the full value of investing in health, we will be making a real and hopefully in future better understood contribution, not only to health, but also to the future economic competitiveness and sustainability of Europe as a whole. Thank you.
Thank you very much, Nick, also for making the link to the topic of the conference this year, with democracy being on the front line, and the link between health and democracy, of course, is something that we've discussed as well quite a bit. You also made a very clear point about having people in the room who are at the very top of the policy leadership, linked to political leadership, who will reflect on what you talked about. So it's my big pleasure, without further ado, to introduce our first panel. So I'm going to introduce each one of you, and please do come up on the stage. First, from our host country, we have Deputy Director-General Stefan Eichwalder from the Ministry of Social Affairs, Health, Care and Consumer Protection. I hope it's still the right name. So Stefan, please. We have Deputy Prime Minister and Minister for Social Affairs and Public Health, Frank van der Broeke from Belgium, who is online, and I hope is right there. Thank you. Just take a seat, I think, over here, Stefan, if that's okay. We have State Secretary Denis Kordesh from the Ministry of Health of Slovenia. Please join us. We have Director Nathalie Berger from the European Commission's Directorate for Structural Reform Support. And we have Director Marco Marcella from the European Commission's Directorate for Health. So a stellar panel. And I think you all have, and we lost Frank, so maybe we can bring him back. There he is. So we'll try to keep him there. I don't know, Frank, if you can see us, but hopefully we...
Yes, I can see.
Very good. So you can see us and we can see you at the moment. So that's the best configuration. So we keep it that way for the rest of the panel. So colleagues, you heard Nick and Nick's reflections on both the importance of investing in health, the need to make the case for investing in health, and the need to figure out how to make it in a way that actually lands. And I think you all have experience either from your country or from the Commission level, also working with a number of countries. And perhaps, Stefan, we start with you. You have a very clear and recent experience with having to make the case for big reforms in the Austrian health system. Over to you.
Thank you, Timi. Dear colleagues, it's wonderful that you made it to Gastein, which is always a bit more tricky than other areas, but it pays off. Obviously, it was a bit more tricky this time, so I'm optimistic that it will pay off even more than typically. Unfortunately, the minister was not able to join this year, and I know that he was very keen in joining the forum, but also this particular session, as it is really close to his heart, and he put a lot of his time in exactly this question. It's an honor to be back in Gastein again, and for me also the privilege to discuss with you these critical topics in health that also Nick, thank you for putting everything on the table pretty much and leaving not much out of it. For us as a topic that we need to look at. We all know that health systems all over the world are increasingly under pressure. You pointed out many of those aspects, Nick, and the COVID-19 pandemic and its aftermath have revealed how fragile and vulnerable our healthcare systems are on the one hand side, but also on the other hand, how important they are for societal and economic growth and as a fundament for everything, yeah, and we saw that, I think, very clear. Beyond the pandemic, other significant challenges have been building over the years, and I think again a topic of this year's edition, particularly in demography, we see all those shifts. We see the shortages in the health workforce, the prevalence of non-communicable diseases, and so many other topics that we need to look at comprehensively. And all those result in an urgent need for strategic investments and structural reforms and being able to prepare for the future. At the same time, we also see that securing funding for health and the necessary reforms is challenging, was always challenging, but is becoming more and more challenging as we enter a new phase in different priorities, maybe with other on the European level and the global level, and also with not so optimistic outlook on our public budgets all over the world. And too quickly and too often it happens that we then refer to health expenditure purely and too much as a cost, as you pointed out, Nick, in not looking in broader into that area. And if we just minimize that, we see that eventually we have so many difficulties that we did not consider when taking this decision, or when this decision is being taken, because typically it happens without the health system around or the health ministry around. So it is about changing this shift and to shift this perception, and to really look into investments in the question of the word that we really want to follow. A healthier society means a more prosperous and productive one, and we know that countries with strong healthcare systems see increased workforce participation, improved overall economic performance, and more resilience. So we all know that, and we have been discussing it so many times, I think even in this room, a couple of years ago, right, Natalie and colleagues, but it's rarely happening. So the question is really, and I think this is where you stopped in a way, why is it not happening, and what can we do to actually make sure that we can understand health investment, health expenditure, and smart investment in that area to fulfill. So I want to share something that the minister would have loved to give as an insight into the last couple of years. And it was back in 2022, when the minister assigned a small team at the ministry with a simple task, and that was the preparation of the next financial equalization negotiations. And this is the Austrian way of dividing pretty much all income from public taxes in the different sectors, to make sure that the different institutions can deliver their tasks. So particularly between the federal and the regions, the federal state and the regions. And he said really make sure that health is seen as an investment, because it's what you all discuss. So make sure that you have the arguments ready, and to be ready when we start these negotiations jointly with the Ministry of Finance. I think that was also one of his very clear statements. And in a healthcare system, as in Austria, that is fragmented and very complex, and many of our countries share many characteristics, yeah? Even though they are very different, they're all complex. We see that those are the times of negotiations when we discuss all money on the table, but we can also introduce structural reforms. And I think that is also what is so important, to make sure that we align the system and the necessary structural reforms to make our health system future fit. And this typically takes financial space to maneuver, but also dedication and clear commitment from all partners involved. So in the end, we finalized those negotiations last year, and ensured additional funding also to make sure that those changes, those structural reforms can happen, and will then be followed in the next years. However, we do see that we could push much stronger, and we could do much more in that regard. And I think that is what the focus also of in this session needs to be, to see how can we ensure that this transformation of our healthcare systems, that is an ongoing process, will have this acceleration that we need if we consider aging, etc. Therefore, we had some experience working jointly with colleagues on the European level, particularly in the Recovery and Resilience Facility, but also a lot with the Technical Support Instrument and other expert groups on the European level that helped us to really look into the areas where we want to bring in structural change and reform. And I do firmly believe that the European Union has even more potential to drive significant change and innovation in our public healthcare systems. So therefore, the instruments on the European Union level can play a vital role in helping us member states to implement critical reforms in their systems, not just in response to crisis, but really in building long-term resilience. And this, in this sense, a crisis, I think, should be used as an opportunity to become stronger and more resilient. Therefore, thank you for all the support so far, and I really look forward to build on those on this work that we did in the last years, and to ensure that the health of our citizens, which is the foundation of our economic and social well-being, will benefit from the work. And to put it simple, it's really about making it happen, right? So we know what we need to do, but now it's time to do it. Thank you.
Thank you very much, Stefan. Thank you very much, Stefan. And I think a lot of what you said also chimes in with what we saw in the conclusions of the Belgian presidency, which ended earlier this year. So we go to Minister van den Broeke online for your reflections.
Yes, thank you. Thank you for having me online. And as a matter of fact, I can only agree with what has been said by previous speakers on the need for continued investment in the area of health. Now, Nick, in his introduction, expressed some frustration with the fact that we have to make that case time and again. And it's true, but Nick, I think we should also admit that we are today, or governments today, are facing many competing challenges, maybe more so than in the recent past. We are living in a kind of a polycrisis environment, which puts pressure on the, let's say, the level of attention a society and thus a political system can give to public health and healthcare. And there is, I would say, increased competition for political capital, for political priorities, for public investment. And so even if we really know that citizens are attached to solid health systems, we also need to convince our fellow members of government again. I think this works best when it is braced by health economics that show the return on investment, by evidence on what works, and also how reform can make health systems more accessible, but as you said, more efficient also. Now, I think to convince fellow members of governments that the first thing is to showcase the return on investment and, let's say, in contrast, the cost of inaction by engaging with actors outside of the health sector. And that is the reason why during the Belgian presidency of the Council of the EU, we organized a joint meeting gathering ministers of social affairs and ministers of finance to debate social investment and reform and their return for resilient societies. And so we were working on the concept of the economy of well-being. We highlighted that healthy populations are productive. Social investments, including health investments, have a clear return, as Nick said, in terms of cohesion, skills, competitiveness, growth, and fiscal sustainability. Now, as Nick also said, it is true that measuring such a return is a very complex challenge. So we should not overstretch what we can promise in terms of measurement. Nevertheless, I think we have to table not only the concept of return on investment, but we have to develop metrics. That is crucial, and I think that's been shown by the work we did with Austria and Slovenia, with support by the European Commission, for which I'm very grateful. So that's my first point. Engage with actors outside of the health sector, have a realistic promise on how you can showcase a return on investment and then deliver on that promise. Furthermore, as you know, as has been said, the EPSCO Council, under our presidency, pushed for an ambitious health agenda for the next Commission. And the ministers defined the areas for EU action, and that is important. One of these is the strategic channeling of adequate resources to where they are needed most. So I would say we not only have to push to put our money where our mouth is, but we should also better identify the priority action, where let's say, the need is highest. And you may know, I won't develop this here now, that this was also one of the topics of our presidency, that is, we need a debate on how to identify priority needs. Now, the EU's funding landscape is complex, and therefore I think more effort is needed to reduce fragmentation and leverage the use of the available EU resources. And EU resources need to be aligned with member states' health policy priorities, including priorities that are defined through the European semester process and country-specific recommendations. And that's a very tangible issue, I would say. Now, to conclude, I think we are aware that limitations and recent cuts on the EU budget have impacted the health funding. But that emphasizes the need to optimize EU funds even more. Let me say by way of conclusion that it is simply our duty to allocate available resources towards cost-efficient and impactful investments that can make a real difference for citizens. I think the EU Health Resources Hub, which we will discuss, can indeed play a critical role in achieving this. And so also, let's say, the pragmatic kind of approaches that will be discussed in this session are very important. In the overall argument, we have to indeed make time and again table that investment in health has an important societal and economic return. Thank you for your attention.
Thank you very much also for reinforcing this idea of why we need to optimize the existing tools that we have in the context of everything else that's going on. State Secretary Kurdes, does that reflect your experience in Slovenia?
Yeah, well, thank you, esteemed colleagues, dear guests. I will start by pointing out how lucky we actually are to be able to spend a considerable share of our GDP on healthcare. More than that, most of the spending is public. These facts reflect actually common values across European countries, such as equity, solidarity, and the pursuit of universal health coverage. These values are shared by most citizens and our governments, even the Ministry of Finance. Now, the discussion that we at the Ministry of Health have with the Ministry of Finance usually focus on a particular reform and the consequent investments. The underlying question, of course, is how efficiently will this be, this additional funding will be spent? Will this actually lead to a tangible improvements in health of the population? And what is the return on investment? A very practical example is provided by a strategy for the development of primary healthcare until 2031, which was adopted by our government earlier this month. The adoption was the final step of a long process, which included discussions with the Ministry of Finance. They expressed expectation that we would estimate the cost of the reform and assess the impact quantitatively to ensure a good return on investment. Okay, we did that to the best of our capacities and capabilities. Our responsibility for using limited resources effectively is not only towards the government or the Ministry of Finance, but indeed towards the whole society. On the other hand, we know that investing in health needs long-term perspective, as the benefits and positive outcomes are yielded in years to come. In practice, as already been said, such quantitative estimates are very challenging. Our strategy has 10 broad goals. Each is articulated through several activities. These activities may relate to legislative changes, organizational changes, training, financing reform, etc. And we have a 7-year perspective. Any estimate of costs and impact is going to be filled with uncertainties. Now, the question is, do we know the needs? Answer is yes. Do we need what we have to do? Do we know what we have to do? The answer is yes. Are changes needed and are they scary? Of course they are needed. Of course they are scary because there are uncertainties present. Is this going to stop us? No. Do we look just on the costs? No. We know what we have to do. We have to accept uncertainties and we definitely move on. I don't say that ex-ante impact assessments are not useful. Of course they are. I merely think it's important that we take the inherent uncertainty of many of these estimates into account when making decisions on investments, or in this case, on a reform. In such situations, quantitative estimates are useful aid to decision making, but we should be guided by the main goal of improving health for all. The role of EU funds in the calculation is fundamental. In our cost estimate of strategy, we also took into account that some activities can be funded through EU mechanisms. This reduces the direct impact of the reform on the budget and hence improves the return on investments from this perspective of the national budget. Furthermore, it provides reassurance that the reforms will be implemented through sound and detailed projects. This means that EU funds can play an important role in supporting investment in health, not only by providing additional funds, but by affecting reform and investments decisions and discussions nationally, both with the government and more broadly with the general public. This is where EU Resources Hub will play a crucial role for member states in preparation and prioritization of the health reforms. So that's from my side for this point. Thank you.
Thank you very much. And I think the last point of the potential crucial role of the hub, we also heard it before, is a very nice connection to our next speaker, Director Berger. You have the experience from the side that receives the requests from member states and the bird's eye view. So give us your reflections on the use of EU funds and EU support in general.
Thank you very much. Dear Minister, dear State Secretary, dear Stefan, dear Marco, and colleagues, we were here 2 years ago at the very beginning of this adventure. Seeing these 3 member states, visionary, having launched a request for support by our technical support instrument to venture into that difficult area, the difficult field of investments in health. And I think that we have done a lot of work in the meantime. We started under the Slovenian presidency, and we had conclusions under your lead that helped us tremendously to move forward. And we have almost closed under the Belgian presidency. We had the latest EBSCO conclusions. We have heard from Nick's keynote and from previous speakers the many challenges that health systems are facing today, including workforce shortages, the fiscal pressures, the extreme tension on budgets, on national budgets for the moment, an aging population and new technologies, and of course as well the challenge of competitiveness. Now we have been working on exploring paths to facilitate the deep health system transformation that is necessary in order to address these challenges. Our technical support instrument project provided support to the 3 member states with tools and expertise, and we've worked along 2 work streams. The first work stream, which ended earlier on this month, focused on enabling the ministries of health to make the case for investments in health vis-à-vis their counterparts from the ministries of finance, because this is, if I may say, the #1 challenge to face in a member state when tabling investments in health. So in Austria, a health impact assessment of primary healthcare units has been carried out. In Belgium, health impact assessments on reducing tobacco sales points was prepared. And in Slovenia, we delivered a guidebook on health economic ex-ante impact assessments. It's always the same question, assessing the costs and assessing the benefits. And there is a second work stream, which will conclude in November, which aims to maximize the impact of funding sources to support the health system reforms. And what we did is that we mapped the EU funds available to support targeted national reforms, and we supported each member state on a specific pilot, which are going to be the subject of the breakout sessions during today's panel. For example, I can mention one among other. Austria worked on the link and an application to the LIFE program to support the greening of its hospital sector as part of their pilot. And this multi-country project also allowed us to reflect on the features and the possible future functioning of a genuine health hub that would serve beyond these 3 visionary member states, the whole of the European Union, the whole of the member states. And this health hub would provide tailored support to all the member states to enhance their capacity to conceptualize, to plan, and to implement, to execute structural health reforms. This hub would possibly have several tasks. First, to facilitate knowledge sharing on potential union funds and other financing sources that could be used to support health and investments. We know that we have a large number of funds. There are even discussions as to whether there isn't the risk sometimes of duplication. When you have duplication, you can also have gaps, different types of interventions. This is not an easy thing to navigate. Second, a health hub could foster networking and promote collaboration between the member states. And with the relevant Commission service to help applicants to better understand the specific requirements for EU funding. And that, when there is an exchange of practice, there is a gain in efficiency. And third, it would support building institutional and administrative capacity of the member states' public administrations, as well as the exchange of lessons learned. So we would be able to set some communities of practices, some good practices together. Now, to get to the implementation, it's a nice idea, but we need to see how to get it on the ground. To deliver successfully on its task, this hub would need to rely on national counterparts who would serve as intermediaries between the hub and the member states. And while the designation of a counterpart would be voluntary, the member states could be encouraged to consider the potential benefits of establishing such a role internally. So that's where we are today, and about to fully finalize the project by the end of November. Now we need to see how to transform the pilot into something that can help all the member states. Looking towards the future, we in the Commission would like to continue this work with our 2025 TSI flagship on the EU Health Hub. So a TSI flagship is a project within the technical support instrument that is pre-designed on the basis of the needs expressed by the member states and in consultation with the member states, and with the objective to facilitate the completion of priorities agreed commonly at the level of the European Union. So we have proposed for 2025 a flagship on a European Health Hub to respond to the invitation that was made to the European Commission by the conclusions adopted by the EBSCO Council under the Belgian presidency in June 24. And this flagship is organized into two pillars, one on quality spending and the other one on strategic investments in health. This is really a structure that is based on the lessons of the project, while maintaining the logic that reforms and investments must go hand in hand. And this flagship will allow the member states to test the hub concept and to explore how a future EU health hub structure could be implemented and on a more permanent basis in response, again, to the conclusions that Minister Van den Broeke mentioned in his keynote address. Now, to conclude, I think I should still address the elephant in the room. We are in a time of transition. Nick mentioned it. Transition for the European Union, transition in every European institution. But what we can already say is that the political guideline of President von der Leyen set out a clear ambition for the European budget to be more focused, to be simpler, and to be more impactful. And in addition, the President's political guidelines also underline the need for an ambitious reform agenda. So this is an exciting challenge for us. And this session is a wonderful opportunity to generate additional input for these discussions. So I would like to express and renew my sincere gratitude to Austria, Belgium, and Slovenia, who have driven this project forward. I would like to thank them for their trust in the European Commission Technical Support Instrument that deeply honors us, and for having driven this project forward with vision, commitment, and enthusiasm. And I would like to thank very much Austria and the organizers of the Gastein Forum for hosting us today. We wouldn't be there either without the deep work and commitment of the experts from Expertise France and of the European Health Observatory, who are our very dear and competent implementing partners in this project. Thank you all very much. Thank you.
Thank you very much, Director Berger, also for addressing the elephant in the room and passing the hot potato to Director Marcella right after you, who also needs to weigh in on this. So please, over to you.
Thank you. So, well, first of all, I am actually deeply honored to participate in this very interesting debate. I think that the Minister van der Broek, the State Secretary Stefan, you highlighted very clearly, and actually Nick in your setting the scene, the fact that the forward-looking exercise in improving health systems is first of all made by shared challenges, which per se it is a challenge. And the second one is that there are unique complexities to address. That's the summa of the high-level messages that we get from the discussion so far. And we should also highlight that the dimensions where these challenges have to be addressed are different. You know, we cover preparedness, we cover the modernizations, the digital transformations. All these dimensions, they per se, they show different, unique challenges. Now, it is a very point to discuss today that these investments would need to be tailored to address these challenges. No, and when we talk about smart investment, essentially, you know, we heard already, you know, how to invest on workforce, when do we invest in digital infrastructure or in infrastructures in general. We invest in innovations in general, in pharmaceuticals, in medical device. So those elements, as Nick put it, creates a model, you know, mathematical or I guess, which is very complex to manage, but is essential to treat. And I would take your two elements of leadership and data and would elaborate on what we are doing together with Nathalie in other elements and other parts of the work programs to make sure that we respond to these challenges. But let me say that if we take these elements, there are two aspects that I would like to underline. So if we need modeling, if we need the data, the leaderships to address unique challenges, then we also need to address two elements that are particularly important. First of all, it is that we need to be sure that we mobilize sufficient investments. And when I say sufficient, this is linked to the modeling and the analysis. And the second one is that we do have the capacity in the member states, in the regions, locally, at European level, to master this complexity, to design these reforms, to understand where the investment should go. Now, if we take this, say, this general framework, at the European Commission, as Nathalie already put, we are supporting, let's say, this way forward, because we are investing through specific funds, EU4Health, the reform, RRF. We are providing the technical assistance, as well elaborated by Nathalie, specifically to support the capacity building. But we are also, because of the differences in the challenges, supporting this knowledge sharing that at European level, it is important, and I must say, it is also very difficult to measure when we say in terms of producing the impacts in economic terms. But we're also working on the political guidance, as mentioned by Minister van der Broek. So the role of the semesters and the role of country-specific recommendations that we are giving every year to the member states. Now, in all these elements, as Nick, you put, we realize the central role of data. So having data available not only, say, to improve health systems per se, but also to improve the governance of health systems. So I'm very happy that we are moving forward, actually, thanks specifically also to the leadership by Minister van der Broek on the European Health Data Space, because the European Health Data Space, once it will be, let's say, deployed, it will provide access to data that will be certainly leveraged for, you know, designing new instruments and reforms. Now, let me say that if we go into the considerations when we have the discussions within, let's say, even within the TSI projects or with our experts, we come to the realizations with the consultations that if we need these optimizations, although at EU level, we need to be in the concept of the capacity, be very clear on two aspects again. So the first one, what are the programs that are there that can be used? And the second one, for which purpose I can leverage and then get the information on how to do that. Now, to make an optimal investment based on instruments and tools that we have, well, the first things that we need to do is to support the capacity so that we can do at national and regional level this evidence-based analysis that would lead to the clear identifications of what I need and where this is. Now that element, it is paramount. And the second aspect is that, of course, at European level, we can complement that work because the challenges, again, are common. So this layer done at European level with projects, including for EU4Health, we see the merits in building systems where we can reflect on common challenges and share how we can approach these elements, the elements of reform. Now, we have done this exercise, Nathalie very clearly put it, in the context of the recovery and the resilience plans, in linking, let's say, investment with reforms, also in the cohesion programs for 21-27, and we see the benefits of that approach. Now, let's say, to conclude the aspect is how do we move forward? How do we move forward in providing the optimizations? I think I would reinstate this. So first, let's say at European level, certainly, as Nathalie said, we will continue to support the member states in creating this level of knowledge sharing, but also in providing the funds, not only, to act, but also to create capacity in the member states. And even in the concept of the EU4Health program, which I'm pretty sure most of you know, we are reflecting on the role of the national contact points, again, to create that level of knowledge at member states level. So I'm pretty sure that in the months to come, these conversations will continue, and we will see that, leveraging each and every program that we have at European level, for which, by the way, information is available, would require a very close link between the work that is done by the officials and work that is done at member states level. And I think that we need to create capacity. Sorry. Thank you.
Okay, thank you very much. I think really encouraging also for the years to come. I think it's very clear we heard the real relevance of optimizing member states' access to the possible funding that is there at the national level, but at the EU level very crucially, and the importance of working together. Now, very ambitious, also today's session very ambitious, because we have still a lot of things that we have planned for all of you. So I would like to thank the panel at this stage very much. Give another round of applause, please, for everybody. And so we need to reorganize a little bit the next steps in the session, because we are running behind in time quite a bit. It's not a loss, because we heard really important elements brought forward for all of you. However, we do want to hear from you in the audience, so we're going to move into our breakout sessions as quickly as we possibly can. And I remind everybody, greening is here in the front, to the left. Then on the right-hand side, we have primary care, and in the back, we have digitalization. Okay, everybody, I will ask you again, stop talking to your neighbor. You had the chance to talk during the breakout sessions. You get another chance to talk in the break after the session, and if you help us, we will do that in the next 15 minutes, maybe not 12, as I can see. So maybe we will take 5 more minutes of your time, but this has been really excellent so far. So indulge us. Let's hear from the breakout sessions very briefly if there was a key upshot, and I would ask Christina to come up here with me and Anne-Marie to come up from the digitalization section in the back, and Mirsha to come up from the primary healthcare to give us just a very short summary of what happened in your group.
So in our focus area, we talked about greening of the healthcare sector, and the main topics that are a challenge right now that we have to deal with is the energy sources for our healthcare system, the energy efficiency of our whole healthcare facilities, and mobility surrounding our healthcare facilities. And we also talked a bit about indicators like carbon footprint, so we have a lot of work to do there. And yeah, these are all areas where we would really like and need to use EU support. Thank you.
Thank you. And where the experience from Austria can be very helpful for others. So the potential for learning from each other is really, really big. So thank you very much, Christina. Mirsha.
Thank you. So our group was primary health care. One of the things that was said was primary healthcare is at the front line of our healthcare system, and this is a very strong argument for supporting investment. The group agreed about the lack of health workforce, which was already pointed out. The question was what we can do about it. One of the things was, of course, there are funds. We have heard that in one country at least, RRF was crucial in jump-starting a reform in primary health care. We heard that sometimes it is difficult to swim through the various healthcare funding opportunities that are available. Sometimes it is a matter of creating awareness. And also what was mentioned is that it creates a sort of a commitment. So once you have sort of funding, then there is a policy commitment to actually carry the project until the end. Also not to forget that we have other sources of support, most notably WHO and indeed the Observatory.
Thank you very much, Mirsha. And the virtuous cycle that you described there, I think, will be really, really important also for the hub. Over to you.
Thank you. And that's a breakout for Belgium and the case around digitalization. And I think it was really clear that when we talk about digital transformation in healthcare systems and digital tools and AI, it's becoming definitely like a really important area that we need to invest in. The question is how. And that sometimes I think one thing we discussed is that can be quite abstract. And that we really need to kind of break it down and to see, more concretely how this investment could match up. And there was a recognition, obviously, of the complexity of the EU funding, but yet an important point that we need to also look beyond health. So beyond, for example, in this case, dedicated EU funding, like we see with the EU for Health program, but that there could be a lot of other opportunities in other funding streams outside the health sector that could have a clear link with digitalization, as we talk about, digital transition in the EU. And there were some examples of TSI project in Ireland and also TSI project related to, AI and social protection systems, but still making that link and leverage between, digitalization and health in the future. And then we finally ended on the note that we also have to remember, who are we doing this for? There was a point about, patients and people and citizens, so that we don't kind of lose sight of the fact that when we talk about digitalization, it's also about people. Ultimately, we just want to make things more efficient, easier to use, to have better outcomes, not just for the sake of, going digital. That's it. Thank you.
Thank you very much, Anne. And I think there also we have a lot of active and ongoing projects supported by the EU exactly to ensure the human side of digitalization. So thank you very much for that to all three of you. Big round of applause to our rapporteurs as well. Okay, and now we're almost at the spot where we would wrap up the session, but we won't yet, because we have key insights from the people who have been working within the front line on the operational side of things to implement changes and to use EU funds. So I'm going to call the group up here, and I'm going to ask you all to be very brief, as I already warned you. So we have Ilana Ventura from the Ministry of Health of Austria. We have Anne Soilouet from the Ministry of Health. This is the English translation. In Belgium, we have Mirsha Kambakap from the Ministry of Health in Slovenia. We have Lisa Maria Voipio-Pulki from the Ministry of Health of Finland. And we have Simon Dres from DG Reform. You will, of course, disregard the timer in front of you. I will be your timer, and you have about 2 minutes each. So the question is, you heard the high-level panel, you heard the breakout sessions, you have your own experience. What do you think is the key takeaway message when we think about the EU Health Resources Hub? Ilana.
Thank you, Dimi. So I think that we really have here a journey together with Slovenia and Belgium, our colleagues here. And it is really obvious that there is a great interest in this topic, and there is also a great need for investing in health. And Austria and the Ministry of Health itself has made really very positive experiences so far with EU instruments such as RRF and TSI. And I cannot stress enough the invaluable support that we have received in order to really bring along healthcare reforms. And in the Austrian case, that's strengthening primary health care and the rollout of primary healthcare units. But still, we face challenges when it comes to accessing instruments and programs, just like any other country and member state. So it has been said, and I think you have been discussing it, it's mainly the complexity also in accessing, and also the fact that sometimes, or quite often, health is not on the top of the agenda of certain EU instruments that can be still relevant. So really, to sum up what we think that a hub could be, is basically a game changer in that sense. We think it can close existing gaps. It can be this bridge to knowledge sharing that was mentioned before. And it can really facilitate, navigate, and pull all the strings together that are necessary in order to optimize investments, optimize synergies, optimize the availability of resources, and align the motivation that we all have to implement reforms nationally and also on the EU level. Was that short enough?
It was exactly 2 minutes, so I'm very impressed. Thank you very much for the good example for everyone else. Anne, over to you. What is it like to be on the technical side of things? Yeah.
But I would like to continue on what Ilana just stated. Yes, the EU funding landscape is diverse and complex to navigate, and I'm speaking here as a civil servant from the Ministry of Health with hands-on experience of dealing with EU funds. When you are planning a reform, you have to figure out which could be the funding opportunities that will match the scope of your reform. The timings are not always aligned. You have also to be confronted with various rule, regulation, eligibility criteria, and it's a competitive and uncertain process, which is certainly time and resource consuming. So it requires really knowledge and sufficient expertise at the national level. And that's why we need with this hub, and that's why we joined Slovenia and Austria to advocate for the establishment of this EU health resource hub that we see as a potential solution to make a better use of the EU available funding instruments. So we really want this hub to strengthen national capacities, but also to disseminate information and to increase the visibility of the funding opportunities for health at the EU level. And at the top of that, the hub would be a direct connection between the EU and the ministries of health when it comes to health investment. So it would be a one-stop shop that would assist member states in identifying the available funding, but also designing the project accordingly and checking the possibility of blending different funding for different streams of the reform. So the idea behind the hub is really to support, and we should not see asking for support as a sign of weakness. We see it as a shift toward an enhanced cooperation and really working hand in hand to make a better use of the EU available funds, and has been said in the first panel, to really strategically channel the available resources to high impact investment. So I would say to conclude that for the main function of this hub, we really want this hub to be responsive to member states' needs and tailored to member states' needs and focus on impact to support really concrete health reform with tangible results on the ground for the health of the population.
Thank you very much, and also for the exemplary timekeeping. I think one point that you bring in that we talked a little bit, but not enough, I think, is this issue of culture, of thinking like asking for help is not a weakness. And I think if we can shift in this cultural shift forward, I think the hub could play a role in that as well. I think it's really important. Mirza, I think you build on what Anne said with your perspective from Slovenia.
Yes, thank you. Yeah, first of all, I second everything that Ilana and Anne have said. From the perspective of Slovenia, I would say we fully agree and support that, and I prefer not to repeat what was said. I will emphasize one point and then perhaps add an additional perspective. The point that I would like to emphasize is the timeliness that you mentioned. So we need what we learned from the TSI is that we need a flexible instrument, also flexible from the perspective of timeliness. I think probably most of the people in the audience are aware of a situation where you have potential reform proposal or a big investment which has momentum, has political support, and you have a very narrow window of opportunity to adopt the reform and then to implement it. And it is in that moment that you need support. And this is why or where an investment, a resource hub can be very helpful in providing that support in the moment when it is necessary. The other point that I would like to make is the question becomes then support about what? And again, a lot has already been said by Ilana and by Anne. In our experience in Slovenia, also one aspect where that support was and can be in a hub very helpful is in articulating a reform which usually has broad goals. Even if the objectives are specific, it is very large and is eventually articulated through a number of specific projects, usually with an action plan in between. Now, getting to that point is demanding, and here a hub can be helpful also because it can help us shape these projects in such a way that they are in line with the EU financing mechanisms that are available. And I would say that this is then a win-win situation because you are implementing your reforms, but you're also making them in line with the funding mechanisms, which means with the priorities that are recognized or adopted at the EU level, because this is what the funding mechanism basically articulate. So this is where I see also the opportunity for the hub.
Thank you very much, Mirsha. I think you answered without knowing it one of the questions that we had in the greening breakout session of potential additional elements such as shaping projects or parts of the reform in a way that means the chances for funding are better. So I think that's really a takeaway message as well. Lisa Maria, over to you. From maybe a slightly more distance perspective from the project per se, what is your take on the EU Health Resources Hub?
Thank you, Dimi. Well, the main function of the hub would, of course, be supporting the member states in accessing EU funds. In full respect for the subsidiarity principle and the responsibility of the member states for their health systems. But echoing a little bit what has been said already, making the case for investing in health benefits from evidence, the to-dos, and maybe even more importantly, the do-not-dos. So everybody need not invent the wheel again and again. And so as policy advisors working in the ministries, we are actually obliged to look for available evidence, and if there is none or very little, at least experiences and practical solutions from other countries. But I can say as a civil servant, and I'm speaking of experience here, that consolidating such often quite technical information can be very difficult and time-consuming from the point of view of a general ministerial advisor like me. Making better use of the EU and EU-related evidence-providing actors, platforms, and instruments would therefore be great help. I mean, they are there, they're out there, but we don't make use of them as much as we could. So maybe the hub could assist the member states by pointing to common challenges, existing networks, impact assessment tools such as the HSPA and the health system resilience testing template. And vice versa, these tools would benefit from member states feeding back from the experiences that they get from the practical reform attempts in real-world exercises. And I added actually one thing in my speaking points listening to this session. I would also encourage us to try to do appropriate microeconomic and macroeconomic modeling exercises together with the ministries of finance and other actors, academic experts and so on, as part of the impact assessment on health and social system reforms. It's tough, but not impossible, and it can be very eye-opening to us all. Thank you.
Thank you very much, Lisa Maria. I think also on the fundamentals of what countries can do to basically make the case for investing in health, as we've been discussing. Simon, last but not least on this curtailed panel now at the end, a reflection on the hub and moving forward?
Thank you, yes. And I'm conscious I'm at negative 30 seconds. So thank you very much for coming today. I think the added value of the hub is really in what Lisa Maria and previous speakers have said, in providing the tools, in providing the forum and the formats for exchange between the countries, and then really in, I would say, a bit of cliche three terms, which is implementation, implementation, implementation. We have heard today about the case, we've heard about the evidence. We need to go to the next level and really work concretely on the challenges. And I think that's what we have been doing anyways in DG Reform through the TSI over the last few years. But I think we have almost like a multiplier effect with the hub of really providing kind of added co-benefits to other member states that can learn from what countries have worked on. I was also asked to speak about the future, and I think I can really not add much to what Director Bégier has already said. We are in a time of transition, but we have this flagship that is really meant to build on the lessons learned, and I think that is a concrete commitment that we have taken, that we expect that hopefully there is interest from the member states to take this work forward in projects, and we are still there. The technical support instrument is still there, and then we will feed these lessons learned into the internal discussions that we are having. But really, I think working on a solution that retains the flexibility and the responsiveness that is so key to addressing the needs of the member states. Thank you.
Thank you very much, Simon, and I think also to this excellent group here for giving us the more hands-on reflections on why the EU Health Resources Hub is a good idea, I would say. I would go as far as saying, and to all of us who've been joining us and online, we hope we have increased your appetite for thinking about a hub like that. I think also in the breakout discussions we saw the different questions that were there not in the room, we were all in the same room, but in the circles of discussion, and I think that links very well into all the potential and how we can then harness it moving forward. We have a lot of insights and inputs from our online participants. We obviously have no time to discuss them here, but rest assured that we have them all and we'll take them away with us. Some of them are very useful for thinking about the hub further. Some of them are useful for example, for the European Observatory and future work that we might do on thinking of some of the questions that you pose that perhaps don't have to do with the hub directly. And this is just to say, for those online, we hear you and we see you. And for those in the room, if there were questions that you would have wanted to ask and there was no time, please come up to us. We will be here for the next few days and we'll be happy to engage with you in all of different ways. So before we leave you to go into your well-deserved coffee, a big round of applause for this second panel that did great with the little time that they had. And then we have a very final 2-minute short video that will reflect on the project that we've been talking about and that you all get to see. Thank you all very much. Here it is.
Funded by the European Commission's Technical Support Instrument, the EU Health Resources Hub project has helped Austria, Slovenia and Belgium build capacity to advocate for public investment in health and identify EU funding possibilities for key national health reform initiatives. The project has shown how EU support, through a pilot health hub, can unlock the potential of smart investment in health reforms.
We have 3 member states who have brought up a very important project and piloted it to help the health ministries make the case for appropriate health investments and thinking about a concept of a health hub that could be used for all the member states in the European Union. I should point to the adoption of Council conclusions inviting the Commission to present a structure for a European health hub.
Member states need some support to get the reforms done, and this is actually a great way to support it by a hub like this.
Through this health hub, we are establishing a level playing field among the member states, a system whereby we will provide advice, we will simplify the access to the number of instruments that exist for channeling funding to the member states.
It's also really from collaborating, learning from each other, and then really being stronger through cooperation and using the evidence and best practices that we see in all around Europe and making sure that we can use that in all our countries. So I think this is really what we see the hub in the future, and also as a strong element for European health policy.
Hub is also a way to put different pieces together. The pieces already exist. The funds and the services already exist within the Commission. Synergies, building bridges, These are the key words.
C'est donc une opportunité unique que nous devons saisir pour appuyer la création de ce hub central, pour investir davantage dans la santé, dans les systèmes de santé, au profit de l'ensemble de la population européenne.
Is it now time to take the next step and create an EU health resources hub for all member states? The case for action seems strong. Our health systems may be diverse, but they share a common vision for a healthier and more resilient Europe.
Okay, so thank you very much to colleagues who worked to put together the video. And the very last word, the session is over. In the Gastein bags that you got at registration, there is an issue of EuroHealth. And in the issue of EuroHealth, there is an article that talks about this issue and also gives you some more specifics in a separate box about the project. This is just to say this is where you can find the links to us if you want to discuss it further and you don't catch us in the coffee break. Thank you all very much for coming and enjoy the rest of the conference.